good afternoon, everybody. Welcome and thanks for being here again. For those of you who were able to join us last week, which I think many of you, we had Joe Da Silva on from the state of Rhode Island, kicking us off and helped frame up this policy development work that we're going to be doing here over the coming weeks to months. And I sent out an email a couple hours ago with a report out from that, and we'll do the same kind of work with this one when our conversations with Jerry here. And as you saw, and you'll see here later on in the presentation, what Dr. Da Silva really helped us set up was whatever kind of policy recommendations that we would come to for a K12 response to the pandemic. It can't happen. It doesn't happen in a vacuum. It happens under a foundation of relevant data, a strategic plan, funding that's tied to it, and throughout the whole thing is stakeholder engagement to make sure that the public is informed, trusts, understands, supports the plan, and so that it can actually be implemented, so it doesn't just sit on a shelf. So that was part of one of the big framing setup that Joe has provided, and is also details there on specifically in thinking about indoor air quality and HVAC planning. And I hope you got and can review those slides as we go here. And this, of course, that document will be added to every time we have one of these meetings with our different speakers, and help this thing come to life. But I think it was a very helpful frame. So Joe, really grateful, and thank you for setting us off on a good foot here. Okay, so I'm going to get into it here. You kind of know the setup last week. That's what Joe helped us do, set up the framing for developing a practically effective policy and the things that need to be tied to it, including the data, planning, funding, and engagement. And this week, Jerry is going to build off of that and talk explicitly about the intersection of, the data on a spreadsheet and how that looks like in the field, and some of the way that the two need to intersect and ground truth the other, so to speak. We're going to look at IAQ, indoor air quality, as a capacity tool, which I think is very intriguing. Back in May, and we looked at what's the different way to think about a COVID capacity, and it was purely spatial. How much room do you have? How many rooms do you have? That kind of thing. And what time do you, how can you use that? Well, given what we've been learning, the quality of your ventilation may have a practical capacity implication for us moving forward, something to think about, at least consider. And how do we do that in a data-driven way? And then talk specifically about community engagement, what a solid framework looks like for doing it effectively, and what some, of course, a couple of the horror stories of when maybe it doesn't. So Jerry, I know many of you I've seen and heard from him in these conversations and outside, very active member of the BASIC Coalition, working with National Council on School Facilities and Mary and team. And he works as the Director of Environmental Science and Occupational Safety and Health for the Philadelphia Federation of Teachers. And so it just brings a wealth of decades of experience doing school-related condition assessments and communications work, in negotiations work with schools, with teachers, has a very boots on the ground perspective that is helpful for us to create something that's going to be effective. So Jerry, welcome. Why don't you tell us a little bit more about where you're coming from and what angle, and Jerry's going to get right into his presentation. As always in these conversations, I will be monitoring the chat. Thoughts, comments come up, please share them, and then we'll hopefully have some time at the end for Q&A as well. Jerry?
Thanks so much, David, and I'm glad to have a chance to talk to everybody like this. The questions and answer piece of this, and as I present, I think will be very helpful both to me and hopefully to you as well, because I arrive at this from a different perspective and place than I think many of the speakers that we've been joined by. I mean, I've heard many of them myself, And my work is primarily as a practitioner. I'm not a researcher. I'm not a manager. And my practice in this field has been long and pretty broad, but also from a very specific perspective. And that is that my work has been on behalf of the people who are occupying these buildings and are using the buildings. And that, of course, mostly is the educational staff. But I also work for the parents and community groups as well. And I do that as an environmental science advisor to them. That work involves me going into the buildings on a regular basis and looking at the conditions in the schools and looking at ventilation and looking at asbestos and looking at lead. And when the COVID situation occurred and schools in Philadelphia closed in March, we already had been grappling in this school district with a number of school closures related to asbestos and lead and mold. So one of the issues that continues, and I think is being faced in other parts of the country, is when we say schools are safe to reopen later in January or February or whenever they are we talking about it in a holistic way or in only with respect to COVID? I've been a participant in the national planning for the K12 infrastructure process with the 21st Century School Fund and the Center for Cities and Schools and the National Council and the Center for Green Schools. I've worked with, on the national level, supporting RASA to get advocating for money at the national level, as well as on a local level with a Fund Our Facilities coalition here. And I have also been involved in a number of efforts that include stakeholders, school district in getting lead paint and lead in water regulations passed in Philadelphia. We also have done some studies in schools, in 50 elementary schools, looking at dampness, mold, and moisture with the CDC. And finally, one of the things that we'll touch on more here, which relates to data and information, is there have been tie-ins with the school district and the city around facility condition assessment and computerized maintenance management environmental reports within this district. So should we go to the next slide, David? I'm not sure where we are, so you'll have to cue me up. Are we looking at
looking at the schools, rec centers, and libraries?
Okay. So one of the confusions that I am dealing with all the time, and I know all of us are what are the standards? For almost anything, what are the standards? What are the distance standards that we have to enforce in order to say we're safe? What are the ventilation standards that we have to enforce? There are three areas that I'm working in right now in Philadelphia that are overlapping. They can inform each other. They're a bit confusing, and they'll kind of relate to what we're dealing with nationally, where we don't know what is being done in what schools and what districts. There are all kinds of different solutions being put in place now. What might be working in Rhode Island doesn't work in Wyoming. What works for private schools and allowing them to open may not work in public schools. Rural and urban schools are different. Here within one city, the staff of the libraries, the recreation centers, and the schools have all engaged with me, and there's some kind of cross-pollination with respect to education. And I wanted to look at this for a minute to give you the sense of how difficult this is, something you probably already know. But here, if you look on the left-hand side, all of the schools in Philadelphia right now are closed for in-person learning, except for 6 schools that apparently are going to open in 2 weeks. It was just announced today. Those schools have as a minimum requirement for space and ventilation, 15 cubic feet per minute of outside air per person and 44 square feet of space per person. This standard is causing challenges in a couple of different ways. The district has has installed this standard. So if they cannot provide 15 cubic feet per minute of air, outside air per person, the spaces can't be occupied. If they can provide 45 cubic feet per minute, then only 3 people can be in the spaces. And we'll take a look at this a little bit later. The recreation centers have been used as educational access centers that are focused on providing services to the most needy children. This means children of color and economically disadvantaged students. And they have a different approach to this. It's the same population of students. These are public school students, not in the public schools. Here, there's a cohort maximum of 22 students per room. The space between them may be considerably less than 44 square feet. There is no cubic foot per minute and no outside air requirement of any type that is actually in place. There is a do the best we can with a 6 air change per hour minimum target put out there. So it's both confusing, an aggressive standard, and no real standard. And it's causing a lot of confusion and consternation. So these spaces are occupiable no matter what, for a reason that we also are going to need to look at, and that is risk and benefit. The understanding of what the risks are if we don't meet certain kinds of standards are important to us being able to move ahead. And in the context of that, what are the benefits? There are also issues of filtration and thermal control that are being presented in these centers and more broadly. Libraries, they have a third approach altogether. And here, the individual who is responsible for the facilities at the libraries has engaged in extensive, detailed, and very collaborative information sharing with stakeholders, has done very deep evaluation of spaces, has established a 200 square foot per person distance requirement, and a requirement that not only is a standard met for a minimum amount of air, but that the HVAC systems are functioning at a very high level and have adequate filtration. Is also brought in supplementary air purification and HEPA filtration devices. So what can we learn from each other in this? And that's what shows up here.
Right.
Should we move on to the next? All right. The way that I conceived what I wanted to present here today, and the way that I engage with this is connected. These things are not fully separated to me, because I'm aware, as are other people in this city and around the country, that there are different strategies being implemented. So what are the real barriers to reopening now? And you've seen a lot of these before, but I want to try to ground them in the current situation. The understandings and the changing, shifting ground about what constitutes acceptable community transmission drivers is something that at least I find to be impossibly difficult to navigate. We right now are in a transmission and positivity situation that was supposed to keep everything closed, including schools, but we are kind of in a pre-opening phase. There are differing views and very limited research about the efficacy of the specific mitigation measures. There's information that talks about the value of masks, and clearly they are of critical importance, and the value of distance, but how much distance is absolutely necessary? Is it 6 feet, 3 feet, 44 square feet? But whatever that is, what happens if we extend those distances, or we shrink them? Do we raise the risks in a way that we might be able to compensate by increasing ventilation? So we don't have good information about this right now. We have limited information about what schools actually look like on a granular level. I've thought often, when I've heard the conversations about schools and opening schools, and schools have opened here and we need to get schools open, something that we all agree on, that schools, it's hard to define what a school is. In the United States, as we all know, they're incredibly variable. They come with, some are, the schools that we're dealing with routinely are an average age of 70 years. That's a different kind of cohort of buildings than something that is new or where there's very robust financial resources. One of the kinds of things that David and I have talked about a lot, and Mary has, is that we don't have good data about that we're sharing with everybody. It's not comprehensive. It's often not transparent. And we just are, it's something that we really are out of sync about. The public engagement process is something that, from my perspective, and I think from the perspective of many, is not working in the way that we think it should. It really needs a very detailed and deep kind of connection between stakeholders, school districts, health officials, and others in order to move things forward. It doesn't really work with questionnaires being sent out or input given, but not an involved planning, prioritization, and solution implementation process in place. And we don't have that in most places. We also don't have coordination between health, medical people, schools, and facility people. Mm-hmm. And we're not very well aligned around these risk benefit discussions. We're not going to have no risk from COVID when we go back into schools. No matter what, we're gonna be experiencing issues, and we're gonna have people who develop COVID-19. What are we expecting when we go back? So these things, I think, if we don't get these right, and getting these right really means that we have the community engagement that we talk about, and you'll see in a couple slides, I don't think we can easily move forward.
Yeah, Jerry, just to jump on some of the comments coming in, Scott echoing, the data collection is a big issue, a really challenging issue, and that without some kind of uniformity to data collection, it's nearly impossible to do really high confident, analyses between schools and areas without wondering if you're doing an apples to oranges. And that's one thing that we're pushing in. So I'm kind of taking notes here. And Scott, I think one of the implications of this below is that, we need to have some baseline standard data collection that pertains to building condition and indoor air quality. One, that Jerry, you mentioned we need some interagency standards between, at minimum public agencies, municipal schools, and so forth. So the schools can't have one standard, the after school programs to have no standard, and then to think we're doing a great job. And then Guy, I mean, your comment that, so yeah, we were talking about outside air and exchange rates. That has an implication for heating and temperature control, and the trade-offs, Jerry. I mean, you're right. Risk benefit just has not been out front on this, and it's health and it's operational risk benefit.
So let's take a look at this next slide, some ventilation facts. But let me answer. I think the questions that were raised are dead on, and it's what I face every single day in the back and forth. So the apples to apples data collection, even within the couple districts that I'm looking at, where a lot of money was spent to bring in airflow, air balancers to look at every room in every school. The kind of the scope of the work was not well defined. So the information that flowed in, and we'll look for a second at it, was uneven, let alone in other states and in other parts of the country. The thing is that scope is something that we can get right. We should. It's in a certain sense, it's pretty easy to know what we should look at. because you're right. If we don't do the same thing, we don't know how to compare those things.
Right.
The second is one of the solutions that is being used around the country is to bring in fresh air, additional fresh air, in two main ways. One is by putting some kind of a fan unit in windows, and we'll see a photo of this. The other is to bring in more fresh air through existing ventilation systems. In either case, the heating concerns, the energy concerns, the comfort concerns, the impacts on the systems themselves, and the filtration issues are profound. And that is something that needs to be included in all of these considerations. All this slide is showing here is that we've got people at Harvard in their public health school. We have the American Academy of Pediatrics and many others who are saying that we do need ventilation as a primary mitigation strategy. We should be following these standards that are out there, mostly from the American Society of Heating and Refrigeration and Air Conditioning Engineers. That number is normally taken now at 15 cubic feet per minute, but that's a very hard thing to achieve. So let's take a look at the why ventilation is needed for just a second, and say that the only thing I'm going to highlight here is that what ventilation is, what real ventilation is fresh air and dilution. It's not fans and air conditioners, which can act as an increasing transmitter for this by blowing stuff around in ways that don't work. So air conditioning and fans are not ventilation. And I think, yeah, okay. So I was going to say maybe we jump to a couple of these photos, but let's take a look at this. And what's really critical here is something that I think is unfortunate for all of us. We're in month 10 of school closures almost everywhere. And really this triangle, this was a day one triangle that needed to be gotten right. And so I know there's some desperation. I sometimes feel this, that we are in a situation that where we're pretty far behind the curve. This community engagement piece at the bottom, this is the foundation. Without it, you can develop any policy that we want, but that policy is going to just be suspended by a very thin kind of support. And that's what's happening. So in the situations that I find myself, people have not been in a community engaged process that works. And so no policy is convincing to them. They're worried about everything. There's a lot of arguing and fighting about everything because the policy built on the planning and even the data it was not built on an engaged process. Nobody understands enough of what they're dealing with. This is really a problem for us right now. And if you look at the next slide, or the slide that I have is next, where this was worked on with David, and David was telling me that in his groupings, he's got 30 to 60 people when he's working with districts that are often part of an advisory task force group of direct and near direct stakeholders. I think of direct stakeholders as students and staff, the people who are in the buildings and who are impacted directly by the conditions in those buildings, and the near direct stakeholders as the stakeholders representing them. But the process that has the right people at the table at the right time, where information is fully shared. If it is uneven information, it gets quickly pointed out. Where that information is explained, there's a clear understanding about what it is we're talking about, what standards we're using. That's an iterative process that is needed, and that the advocacy for funding actually comes out of such planning efforts. And the policy that can be implemented can only be implemented, I think, following that. It can only be implemented successfully following that. I'll only use the district that I know very very well here, where in the district in Philadelphia, and trying to open a couple times was unsuccessful because of so much public pushback. And that kind of situation is often not productive for anybody. So we need this planning process.
And Jerry, just to stop on this one, just would love some feedback perhaps from folks who have been directly engaged or on either side, either a recipient and participant or a leader of engagements around, let's say COVID right now. Do we have a good, bad, and the ugly? I mean, can somebody share some of their experiences with those kind of engagements, and what have they followed this kind of frame? Have they included direct stakeholders in a representative fashion? Have you kind of looked through things systematically? What's been the experience?
David, most of the experience in Idaho has been an anathema to that process. We've been, building the airplane in flight and driving at 200 miles an hour in the rearview mirror. Right. And what we've had is our trustees, who are very high paid individuals in Idaho, trying to make reasonable decisions. We've had, there are recall petitions in 50 of the 118 school districts in Idaho, and folks are just throwing up their hands and quitting. Mm-hmm. We've had 22 superintendents announce intention to retire. It's just been crazy.
I will agree with the first part of Guy's comment on that it's the opposite of this. I don't believe that our facilities department, and again, I'm not part of our facilities department, Vonnie from Salem Kaiser Public Schools in Oregon, I don't believe they're working with the stakeholders, particularly on ventilation, for sure. Maybe on some of the rest of the stuff. We fortunately don't have what Guy has with everybody retiring here.
So this is Debbie from Goochland, Virginia, small school district, but we made a very quick decision not to open in August, and it infuriated our community and our board of supervisors, who fund 80% of our school division. We don't independently fund ourselves. So we had very engaged school board meetings, and everybody was very involved in the community blowback. But we couldn't get our teachers to commit. So thankfully, I've been listening in on these series, and with the county gave us a lot of their CARES Act funding, and we did major HVAC upgrades, and we brought in a HEPA filtration unit classroom size for every single classroom. And so we have been able to open since mid-October because of the politics of the situation. So we improved our HVAC, we put in the bipolar ionization units in all of our big equipment. Like I say, we have classroom filtration units in every classroom and the office spaces. And so it was actually an incredible day, the day that all those filtration units arrived. Every staff person was out on the streets breaking down those units, because we actually started our full in-person schedule the next day. It came in on a Friday, and everybody was supposed to have kids in their classroom on Monday. So we had every teacher engaged in breaking down those units and getting them set up, rolling them from the curb into their classrooms. And it was just a positive, very, very positive thing. It was that little confidence boost. Now with community spread, like everybody has, this high volume, it's like, why aren't we closing? So we are hoping for that next little boost to be the vaccine, which may be coming to our staff next week. So um, somebody asked who maintains our individual air units. We are using our next round of CARES Act funding to, we were told that the pre-filter units, pre-filters go first. So we're going to buy, we're going to use that CARES Act funding for the pre-filters. I must tell you that I probably set up a third of our units. I read the instructions and I went around from classroom to classroom. I am the chief financial officer, so I don't really have anything to do with maintenance, but I can certainly program these things. And so I'd go into a teacher's room and I'd set it up for them, and I'd set up all the parameters, and I would tell them what they could and couldn't do. Mm-hmm. And then I moved to the next room. Just that little bit of discussion with each of those teachers, again, was sort of that engagement with the staff to make them feel more comfortable. So that's what we're doing in our school division. We really put a lot of money into that, what we could afford out of the funding we got, and that, 12/30 deadline. Mm-hmm. We had an HVAC company working all through winter break to change out obsolete AC unit or HVAC units in 2 of our schools, our oldest schools.
So David and Bonnie and everybody, I think they're incredible stories. We're all in that same exact place, really, wherever we're coming at this from. My experience has been a little bit more like Guy described, but we're aiming for your experience, Bonnie, and your experience as you relate it, highlights for me 2 things. One is that this staff and parents have a very different feel about safety, in part because of what we all know. One is kids and their parents, and we know what some of that information is around kids and parents, and the other is the staff, older and more at risk. And it sounds like you found an amazingly effective way of doing both the bottom of this period, this pyramid of community engagement. You did actually engage with people in ways that worked, maybe initially not, maybe initially yes. Mm-hmm. And then there was a response. There was a strategic planning response that was really responsive to the concerns and needs of the staff. The concerns and needs of the community were already sort of set in a way. As I understood your story, when you closed in August, a lot of people were upset, but that probably didn't include the teachers. They may not have been upset. And as you move forward, by October, within 3 months, you have schools open. That's an incredible success. Here, our schools have been closed since March. And we haven't had that kind of engagement and that kind of talk. So I think this is really valuable. Mm-hmm. And it's the kind of story that, like some technical information that we'd want to be sharing, should be shared. So thank you very much for that. I think that really is important. David, can we take a look at the next slides?
Yeah, I moved on. And
where are we?
Jerry's flying blind right now.
Yeah, sorry, but
we're on the ventilation with the in-room ventilator, the outside air, and the window unit.
So I'm going to be kind of quick, and I'm going to like play off of the comments that were just made in a way. These are the situations that we're addressing. And the top one showing a room air conditioner, the second, a classroom unit ventilator, and the third, this supplementary outside air that was a solution that was developed by the district folks here. And people are really scrambling, that's true. But here's what's going on. There was a lot of talk for a long time that the air conditioners were ventilation. That caused a lot of problem and kind of bad will and a lack of trust. Our classroom unit ventilators tend to be in the 40 to 60-year-old range. And so their ability to bring in fresh air is very limited. One thing that has been seen as they have been evaluated is that the condition of the mechanical components, linkages and louvers and control technology just don't work. So what do you do with these things, and what are we learning? Do you force them open and then have problems with heat and freezing pipes and something on the other end? Whatever you do, one of the real values of the evaluation done well is that there is now a full accounting of what the mechanical needs are in a way we didn't have before. The last image is the idea of putting in a small fan unit in some of the operable windows. We have about 1,100 rooms in this kind of a condition. No mechanical ventilation, but operable windows. This unit supposedly blows about 250 to 300 cubic feet per minute of fresh air into a space. It's unconditioned air. Right now it's 38 degrees where we are. It raises issues of comfort and thermal control that are huge. So again, when these kinds of built conditions are there, or this kind of solution is considered, we need to engage in the way that Bonnie described, I think, to kind of get over a hurdle. And if we can look at the next slide quickly, we're just looking at kind of an equivalent issue just for a moment, which is space, effective space and real space. So all we have to go on are the kind of drawings that we have on the right-hand side of this. What is not being openly shared and presented to everybody is the real space and configuration of classrooms. And so we might look at room 108 and believe that we have a 20 by 30 foot room. But as you see in the image for that room, we lose a lot of the effective space from build-ins or from temporary cubbies or radiators, as you see, that kind of thing. So again, this is about really knowing what we know and understanding it, and making sure that we're on the same page that way. David, I think in the interest of time, although I would like to jump for a second, if we could, to
Sure.
the slides that are looking at, that I have as case studies, that are the charts. There are those four charts.
Okay.
We'll
Yeah.
only take a moment, and then we can, you'll guide me through
Okay,
our
we're there.
findings here. So if we're looking at what I'd like to do is look at these four as a piece. So I'm going to focus on this first one. And this first one shows you all zeros in the two right-hand columns. And then we're going to look at the other three, but just quickly to understand what kind of data we have and why it's a problem. So the study here was go into every classroom in every school. That's about 10,000 to 11,000 classrooms and related spaces, and to measure the actual outside air. And from the measurement of the outside air, assign a maximum occupancy based on that. At the same time, there's a maximum occupancy being derived by the amount of space at 44 square feet per person. The lower of those two numbers, everybody has been told, is what is operative. So this is our highest performing high school in Philadelphia. And as you can see, every area has a zero. So you can't occupy this building. But there are operable windows in this building. And this presents a couple of confusing and difficult issues for people. One is, really, what does this mean? We thought we had air in the building before. We've been in that building. We know that you have to have some airflow at some point. What is happening here? And can we really not use this building, no space in this building in any way? We're in January now. Is the only way to use this if everybody is vaccinated? One of the things that we're not seeing is how this testing was done who did this testing, when they did it, and what exactly happened. So we still don't know exactly, but some of what leads to data like this is that the areas were locked or there was some other problem. The other is that there was an issue with operating the ventilation system. And so somebody might have come back and done something later. We're not sure about that kind of thing. But in addition, you'll see if we look at the next one, this is, so this second one is a second school. No, this is just the same school. I'm sorry, David. Same school. All right, so go to the third one of these, and here you'll see a mix of these kind of rooms and operations, the ventilation system. There's no way to know exactly what happened in these rooms or why you've got classrooms next to each other at 0 and other classrooms with measurable amounts. And one thing we do know is that it reflects some kind of maintenance related issues. And it raises again some of those same questions about the conditions of the school historically, right before this and now. What needs to happen here? The last one is a school that raises a different kind of an issue. This happens to be an elementary school that is about 90 years old. And these airflows and these occupancies for classrooms don't make good sense. You can't have these kinds of numbers in spaces like this. And over the years, in evaluating these spaces, it's been able to be documented that there's inadequate airflow. So it's not clear what's happening here, but some of what has gone on is and is understandable is as the balancing and airflow testing people have gone in, they've identified problems with airflow. And if there are mechanical people with them, they will take a look at some of the operating systems and they will make fixes to those systems kind of on the fly. This is a good thing. So while I don't think this reflects that exactly, we are seeing data like this that reflects that kind of situation. But what we're not capturing is what those fixes are and what's needed. So again, I don't want to beat this to death. It's more to say that the getting good data, and I think this is what supports what was said just a few moments ago, is really, really crucial. This is what we get to see. This is the data that is publicly published, but there's no engagement around that. If we go back to the slides that I think maybe start with 14, the main office of the school.
I'm there.
Okay. All I want to show you with these is kind of both a site truthing kind of approach, and again, to provide some of the texture that is leading to the problems that I think are being faced everywhere. Again, I don't mean to continue to talk about Bonnie's scenario, but it was really a great one and very illuminating. We're not there. So here, this is the main office of the school, and we went in to take a look at what the ventilation system operation was. Mm-hmm. Now, you can sort of see a supply register right above a diffuser in the top left of this photo, and you see a barrier at the front front desk. And there's no air flowing. This school was minimally occupied by some staff, but there's no airflow through this at the moment. If you go to the next slide, actually, let's see, they're a bit out of order. So go to, well, I don't know. I'm looking at a slide that has the small office inside the main office, David. Are we there?
I'm there now.
Okay, so the small office inside the main office is exactly what it sounds like. We just walked into that office and we went into this room. The time we were in this room, there was an individual sitting there. And this individual was sitting under the supply diffuser you can see right above in the top left. I hope everybody can see that. And if you go to the very next slide, you'll see this as a close-up. And what you should see, although maybe a bit difficult, is that this is covered with a plexiglass sheet. Now, this was covered like this because during the typical operation, this was a created room. It was too uncomfortable for the individual sitting there with both air conditioning and heat. And so the school had done this as just their own in-house solution to divert the air. I mean, they sealed it off completely. One of the questions that came up during our walkthrough was what happened in the testing for this room, because the testing for this room indicated that there was some airflow. So I think I know that this is a lot and a bit of jumping back and forth. I know we're at 3:47 now, and we want to kind of pull together something at the end, and we have a couple of slides. Should we jump there, David?
Yeah, let's go. If you want to talk about the ventilation standards and the way to think about that, it goes back to something that we had conversations with quite some time ago with Anise, I think you're on, and your partner at GBC, and kicking off this CO2 conversation. So
are we at the slide that says ventilation? We have
Yeah.
Okay. So again, with ventilation, we have 5 primary mitigation strategies that we are talking about inside of the buildings. I'm excluding at the moment major ones that are medical, isolation, tracing, testing, all of that, which is obviously crucial. But once we come into the building, what are we looking at? We're looking at cohorting, distancing, masks.
I never got this to work, or the Bluetooth in there.
I'm sorry?
go ahead.
Personal hygiene, sanitation, and ventilation. Ventilation is the most challenging because it's the one that falls on the system, the district, to do stuff that costs money, and to do stuff that costs money in buildings that we have not properly funded for many years. That's clear. So what do we do? There are a couple of standards that are being used fairly typically. One is the cubic feet per minute per person of 15. That comes from the ASHRAE, the American Society of Heating, Refrigeration, and Air Conditioning Standards. If you meet that standard, generally, you will keep CO2 levels in those rooms at a value of about less than 1,000 parts per million, sometimes considerably less. This is really considered a minimum standard all the time. It's not COVID related. If you don't do this, if we allow the levels to go above 1,000 parts per million, there's been very good information, data, and studies to show that we have significant deficits in learning, in academic achievement, in all kinds of things. All contaminants are increased in that kind of scenario. There's lost time from schools because of illness. So this 15 CFM per person, something that we are typically very far away from, is a very minimum standard. The other way to think about some of this, and you've heard some of this during some of the previous presentations, and you'll hear it more in other webinars when we're talking about some of the more technical issues, is air changes per hour. And this, of course, means that you have enough volume of air coming in based on the size of the space that every 10 minutes you can evacuate all the air from a space and replace it with an equivalent amount of air. So if you have a 30 by 30 by 10 foot room, let's say a typical somewhat large classroom, you're at 9,000 cubic feet.
Mm-hmm.
If you're to have 6 air changes every hour, that means that you have to get rid of 9,000 cubic feet every 10 minutes. You're going to evacuate all that, and you're going to do that 6 times. And if you start thinking about this in comparison to the cubic foot per minute calculations, what happens is that at some point these two things will come together, but often, especially in larger spaces, the air changes per hour become very, very, very difficult to achieve. You can have 15 cubic feet per minute in a space, a smaller space, that results in more than 6 air changes in an hour. But in a gym, in a larger space with the same number of people, you'll never get close to the number of air changes you need. In any case, the idea of both of these standards is to keep CO2 levels in check. CO2 is something we breathe out. It's not a contaminant itself. But one of the things, as we look at the last chart, this is something that David and I kind of worked on. David was thinking about this, and we're going to look at this for a second as we finish up. One thing to keep in mind is that, you know, there is an opportunity with CO2 that I think is interesting. I mentioned this to David. I've thought about this over the years, and we've explored it occasionally. CO2 sensing devices are readily available, and are actually, there's something that could be built by students in, let's say, STEM programs, and they can be built pretty easily, inexpensively, and they can be purchased relatively inexpensively. They could be used as a monitoring device in rooms where we might not have all of the ventilation that we need, but we're close. And one of the things we can do is use some sensing technology to see when we are above some trigger level, and then use that to modify programming. That is, to break students into smaller groups, or to move into other locations, or to do other kinds of activities. But in any case, what this chart here at the end is showing is trying to provide an idea. Can we create a matrix? And it doesn't have to be limited to just this. That says along the bottom axis, if we have CO2 levels in a range starting from the left that is essentially outside air, moving up to a level, can we define a level that we would say is so much above, outside of an acceptable range, that when we hit this level, you shouldn't be occupying the classrooms? Can we create such a range? This one is pretty good, actually. We often in classrooms throughout the United States are frequently in the 1,000 to 2,500 parts per million range. But in any case, can we then tie these levels, these measured levels, to specific actions? And that's what I think David tried to do when he, on the y-axis of this, you know, and those kinds of things are to increase or to start to use masks, to reduce capacity, to increase ventilation, fresh air coming in, and in the final analysis, close a room. But the last thing I'll say before I stop is that the idea of layered mitigation strategies here does, for the kinds of things we're talking about, really includes reduced capacity, increased distance, masks, and ventilation. Those things can be used in some proportionate relationship if we think about how we might be able to manipulate these different strategies. Again, it was going to rely on the kind of thing that Bonnie talked about and that we've been talking about here, which is an engaged stakeholder process, so people are all on board and are walking together in understanding these things.
Yeah. Thank you, Jerry.
You're welcome.
And yes, very much would appreciate some initial comments and feedback. You know, Guy, the canary in the coal mine analogy for CO2 has been something that's popped up regularly throughout the conversation, and that's kind of the idea, is that it is a proxy for quite a number of things. And it tells you whether or not you're ventilating enough. The other things, the CFMs per person and so forth, and air exchanges are good standards to have, but it's that CO2 is going to give you a catch-all And again, I'm no HVAC, I'm an expert, and we're going to have those, and Jerry's, one of them. But that's what we've been hearing. So, but at a minimum, that this kind of matrix improved it will be throughout this process. But this is the kind of guidance that we've been hearing is needed. Here's a threshold, and within this threshold, you're okay until you get to this threshold. You can think about doing X, Y, Z. Once you get to this threshold, this is your do not cross line. But having something that you can measure in a transparent way with specific actions gated to that is what we're trying to accomplish.
So thank you very much for giving me the opportunity to talk to you about this. And if there are questions, I'm happy to try to answer them.
Yeah, please unmute a small enough crowd, or type it in the chat, whatever works best for you. Appreciate the comments that are coming in. So Rob, your question about this again ties back to, I think, what Joe was bringing up last week. Do some of our older HVAC systems in school buildings capable of these are they, some of them, capable even of these standards if working properly, or do districts need to consider replacement? Jerry, I mean, you work with quite a number of older schools, and I'm assuming many of these systems are past their life cycle. Are these standards, I gather that they are attainable in many cases, but not all, and it has part to do with school design, I'm hearing, not just the system itself.
I think they are attainable in the sense that the systems were designed to be able to deliver this kind of capacity in general. But I think they're practically unattainable in many cases, because the equipment, the ventilation equipment that's in place, has not been maintained such that it can function in this way, and that does create a problem. So I think what you try to do, what's happened in many places, is what you saw with that small office. The outlet is completely covered and blocked. So you want to try to do whatever you can, and there are things to do to increase the airflow and fresh air through these systems. But yeah, it feeds into a replacement strategy eventually. But for now, we need to make improvements that we can make.
Right, and Vonnie brings up the obvious question, with what money? Like, what are we talking about in terms of cost? And the individual units themselves on smaller scale aren't daunting. It's the larger scale that it gets complicated. We're talking a couple $100 to get the monitors. And one of the idea, I frankly love the idea of STEM classes building CO2 monitors. I think that is fantastic. I think that would be something you would want to supplement with a handful of professionally made ones. But still, I think that from a learning opportunity, that's just fantastic. And if you, Jerry, if you have resources on sort of the how-tos of that, or examples of folks who have done it, I think I would love to share that. The other thing, Jerry, is what do you think, when you're talking about, Debbie in Goochland, Virginia, small district, the CO2 monitors for every classroom may be within the realm of possibility in the near term. When you're looking at, the state of Maryland, that's going to be just a different scale. So what about, what kind of strategies we should suggest? Some combination of DIY with the portable monitors that, you can take around to rooms and spot check at different times. What would you suggest?
I would suggest something like that when you're using that kind of an approach. Sure, the handheld monitors, the kind of monitors we use for data logging cost about $200 a piece. You can imagine if you had 10 of them in a school, that's $2,000. And a larger school with 50 spaces, you would be able to kind of pass those devices around and use them for a couple $1,000. You could do that kind of thing. So there are handheld devices that someone like me uses as we walk around, and those devices cost between $500 and $2,000 for the device. But if one of those was placed in a school and a building engineer, somebody who was trained how to use it, was able to do that, they could walk around the school on a regular basis, on an as-needed basis. There are times when you would know you don't need to be doing that constantly. And you can do that if you could do it as a complaint response, room by room. But I want to say something to Bonnie's question about with what money, because I think that's right. But here's what I would say. We don't know what money some of this stuff costs these days. You know, Bonnie talked about having air purifying devices in every room. Or I'm not sure what specific equipment, but it was something like that. That's happening in Philadelphia in some of the libraries and even in some of the recreation centers. There are the fan units that go in. How much money are we talking about on the maintenance end, like fixing or doing the repair modification to existing ventilation systems? Sometimes it's in the millions of dollars, no question. But other times it's in the hundreds or thousands of dollars, and it is really accomplishable and doable. We have CARES money and other sources of money. I think one of the problems we're all facing is if you were to ask me or the facility director or the COO in Philadelphia and in many places, so tell me, how much would it cost to get a significant amount of additional fresh air airflow into X number of rooms without compromising systems? What can we do? I don't think we have the answer to that. I don't think we're close. And we should know that we were able to put in the units Bonnie said in Virginia for $500 a room, and we have 10 rooms, that's 5,000, or we have 1 million rooms and that's that number. How about with what does it cost to do these kinds of maintenance activities? There's a broad range, so it's hard to be certain across every situation, but there's a lot more that we could know that would help inform decision-making in a much better way and guide the prioritization with respect to the spending of the dollars that come in to the districts, hopefully over these next months and years.
Okay. Yeah, and that speaks in part, Jerry, to again, what Joe was mentioning last week, the funding side and the advocacy, is that there are, as we stated on our call this morning, there's structurally impossible financial situations that many districts are in, where simply it's not, you can't do it all. And that's the point where advocacy has to come in.
Correct.
Yeah.
I mean, and we need, what the good thing about being sort of nakedly transparent is that there's something embarrassing about it. Of course, being naked is always embarrassing. Well, maybe not always to everybody, but but the thing is, nothing's hidden. It's clear what you need, and I think this is a thing that we've kind of missed often in our dialogue. The revealing of the conditions honestly, and saying, look, we didn't do this. We've inherited this. This is the situation we're facing, but this is the situation. This is what it looks like. This is what it means. This is what we need. I think that's the way to advocate and get money.
Right.
So.
Yeah, I appreciate that. And we're going to wrap it up here. I just wanted to thank, and Cindy's Powell's comment, I'm going to close on this, and I think it's a really good one. And that's taking a holistic look. The implications of buildings not meeting the standards can be significant, practically, politically, and otherwise, especially with older buildings or buildings where HVAC systems haven't been maintained. It could be that a school doesn't have sufficient space to decrease capacity or the funds readily available to correct the problem in a timely manner. And this is part of that, to go back, Jerry, to your community engagement piece, like just the communication of what's actually going on. What is the situation and why are we in it? And part of the reason I think it's been so strained is what we were advocating this morning on the call with Mary about, is a lack of specific standards and guidance at the top that we can all orient ourselves around.
Absolutely.
So that's something that, trying to work on, but we will, and Debbie, and thanks all for the chat comments. Debbie, thanks for all the information on the filter units there. Very helpful. we will take this information as we did last week, and we'll put it into a succinct report form like we did with Joe's presentation last week. Still confirming our speaker next week. I'll get that out to you as soon as possible. Have a great rest of your day. Thank Jerry on your way out. Jerry, thank you very much for everything today included. And have a great rest of your weekend, and we will see you all next week.
Thank you, Jerry.
Thank you so much.
Thank you, Jerry.
Thank you.
You're welcome.
Thanks, David.
Bye-bye.